Good evening, everybody. Welcome back to the channel. I hope all of you are doing good. Today is going to be an OET class. One of the classes that you might be looking forward to, which is the OET reading part B and part C. So let's go for it. So as we have discussed earlier, reading part B, you're going to be having 6 questions, out of which you should be scoring at least 4 correct. Yeah, that's the idea. So the approach is that we're going to be focusing on the keywords. Now, what exactly are keywords? Keywords are names of they are nouns or names of people or person. That keyword is for part C. For part B, you're going to be making your own keyword in your mind, like a shortcut. So let's look at the first question. Nursing staff can remove a dressing if. So the question is about the nursing staff. You're going to be given one paragraph in part B, so there'll be an assigned paragraph. You don't have to search for which paragraph. You don't have to locate it as such. So here, nursing staff can remove a dressing if. So there's a condition when they can remove. It's about removal of the dressing. And who's going to remove? The nursing staff. A member of the surgical team is present. So presence of a surgical team member, that should be in your mind. Should be the surgical team member. That's what should be present. So what's going to be in your mind is that member of surgical team, presence. Yeah. Second, there is severe leakage from the wound. So here, severe leakage. So first, the keyword is here, leakage is the keyword, and another word which is going to help you is severe, not a light kind of a leakage, but something which is extremely uncontrollable. So, and the third is they believe the wound has healed. So third is going to be healing of wound. So not necessary, Ishita, as you can hear me, not necessary each and every option you'll have one or two keywords. Like for the first one, you couldn't find much of a keyword, right? But you still, here you can find keywords easily. Severe leakage, and here healing of wound. So with that in mind, let's read the paragraph. Dressings are post-operative dressings. Dressing. So let me just reiterate in my mind. Member of presence of a surgical team member. Second is about severe leakage. Third is healing of wound. So healing of wound is the, so first one is the member of should be present. Second is severe leakage. Third is healing of wound. That's set in my mind. I'm gonna just carry that short-term memory. I'm gonna take it in my mind till the time I don't read the paragraph B. So that's already set in my mind. Yeah. Okay, now let's approach. Post-operative dressing. Dressings are an important component of post-operative wound management. Okay, it doesn't help my question, right, Ishita? You can hear me, right?
Yes, yes, sir.
This doesn't help me. This is just a general sentence. Okay, dressing are important component. Okay, fine. Yes, they are, but no help for the question, the answer. Any dressing applied during surgery have been done in sterile conditions and should ideally be left in place as stipulated by the surgical team. Okay, it's a statement, but it does not help my answer. It is acceptable for initial dressings to be removed prematurely in order to have the wound removed prematurely, uh, in order to have the wound reviewed, and in certain situations applying a new dressing. So till now, do you see any help with the answer? No,
No,
right?
sir.
It is now.
No.
Now this is a good news. When you are reading a paragraph and you're not finding anything related with the answer, which means that now you're going to be focusing on 2 or 3 sentences where you will definitely find the answer. Okay, so now the focus is going to be on this sentence. These situations include when the dressing is no longer serving its purpose, that is falling off, okay, falling off,
Yes.
excessive exudate soaking. Is that helping me with the answer?
Yes, sir.
Yes,
Yes, sir.
it is giving me it's helping me to go and locate the answer. Now how? Excessive is a synonym of severe.
Severe.
Leakage is a synonym of soaking,
So,
right? Excessive
yes.
exudate soaking is a synonym of severe leakage. Okay. Through the dressing and resulting in suboptimal wound healing environment or when a wound complication is suspected. So, can I strike it out? A member of surgical. There is no
Yes, sir.
mention of
Is
any surgical team member being present. It's not mentioned at all. Severe leakage, yes, this
yes.
is closer to the answer, but still, let me not finish that answer. Let me not, just choose that answer. Let me also consider the third option. They believe the wound has healed. There is no mention about them removing a dressing if they talk about healing of the wound, right? Because let's see, these situations include when the dressing is no longer serving purpose, okay, or when a wound complication is, so it's talking about complication. It's not mentioned anything about healing of the wound, has it? It has not mentioned
No.
anywhere, right?
No, sir. No.
Therefore, strike A, strike C, and we have B as answer. Even if we don't eliminate the part A and C, we still have B as the answer because we found the synonyms. Okay, IELTS and OET are in a big way a game of synonyms. If you get this in your mind, life is easy. All right, let's go to the next
Yes.
question. As explained in the protocol, the position of the RUM container would ideally, okay, so this is talking about the position of the RUM container. So basically, there's a container, and it's talking about a protocol. Protocol is what? Rules and regulations, right? According to the position, the, the RUM container with ideal will be like in any given, like a normal, like by default. So the position, the where it's placed. First, encourage participation in the scheme. So first, what's going to be the keyword this time?
Encourage participation.
Encourage participation. Very good. So encourage participation. Second, emphasize the value of recycling. So second, what is it going to be?
Recycling.
Recycling. Okay. So encourage participation and then recycling. Next, facilitate public access. So third is public
Public
access.
access.
Public access. So let me think in my mind again. Encourage participation, recycling, public access. So that time just have to focus and keep in your mind, even if you don't read it. I mean, anyway, you have it in front of you, you can read it, but just keep it in your mind, like carry it in your mind when you're reading it. Yeah, like keep it on the side, like just within the range of your concentration. Yeah. So encourage participation, recycling, public access. Okay, that's set in my mind. Now let me go and read the paragraph. Unwanted medicine pharmacy collection protocol. RUM. We are reading what's RUM. Returned unwanted medicine project approved container will be delivered by the wholesaler to the participating pharmacy. It does not help with the answer. It's just mentioning the RUM, which is fine. The container is to be kept. Okay, here the answer is going to be there because container, it's talking about where it's to be kept in a section of the dispensary or in a room or enclosure in the pharmacy to which the public do not have access. So,
Access.
what do you want to strike out now?
C.
See, absolutely. Why? Because It says which public
That
do
do
not
not have
have
access.
access. So facilitate public access, remove that. Now life is easy. Why? Because we have only two options, right? Container may be placed in a visible position, may be placed in a visible position so that they can see it, right? Visible position, but out of reach of the public, as this will reinforce the message that unwanted prescription drugs can be returned to the pharmacy and that the returned medicines will not be recycled.
So the B should also be striked off.
Okay, do you think it's B? Is it talking about the you want to strike it out B, or is that the answer for you?
Strike it out, sir. Strike it
Strike it
out.
out. That's it. That's it. You strike out B, strike out C. There you go. That's the answer.
A is
Encourage.
the answer.
So here, that's it. Okay, let me just finish it anyway. Needles, other sharp and liquid cytotoxic products should not be placed in the container, but in one space. Okay, anyway, this doesn't help with the answer anyway, right? So we are focusing from here. So first thing is here, elimination method helped you get the answer, right, Ishita? You got it. You just
Yes.
eliminated
Yes.
them and you got it. Now, even if we do not have the elimination method, still there is another indicator, big indicator. What? This will reinforce the message. Reinforce the message, yeah? That unwanted can be returned to the farmer. So it's placed in a visible position. Why is it in a visible position? Why? Because they want the public to see it. Correct?
C.
So, when they see it, the participation can happen only when they can see it, right? If they did not
Yes,
want to
sir.
encourage participation, they would have hidden it, right? But they want to
Mm-hmm.
see it. Clear? Is this done? This is
Yes, sir.
pretty easy, right? Second one.
Yes, it was easy.
Would you like to try this one?
Yes, sir.
Okay, let me read it out for you. The report mentioned in the memo suggests. Okay, so we're talking about a report in a memo. First, data about patient errors may be incomplete. May be incomplete, not saying it's incomplete. Data about patient errors may be incomplete. So, it's talking about incomplete data, right? Incomplete
Incomplete
data.
data.
Okay. Next one. Errors by hospital can often go unreported. Okay, what are the keywords
Errors
here?
unreported. Errors
Unreported
unreported.
errors. Unreported
Yes.
errors, right? Unreported errors. So, first is incomplete data. Second is unreported errors. Okay, third, errors in prescription pose the greatest threat to patients. Errors in prescription
Prescription.
pose the greatest threat to patients. So, let's see what is the keyword. Prescription errors.
Prescription errors. Yes,
Or you
sir.
want to go for greatest threat? Which do you think is a better one?
Um, the greatest threat
Okay, okay, we can
to
keep it like
patients.
that. Greatest threat. We can see when we find greatest threat, we can go for the errors in prescription after that, right? Just to reconfirm.
Yes.
Okay,
Yes.
so first one is going to be uh, incomplete data.
Incomplete data.
Okay, second is unreported errors.
Unreported errors.
Okay, unreported errors. Then uh, greatest threat to
Greatest threat.
patients. Okay, so okay, let's just say patient threats. Okay, patient threats.
Patient
Okay,
threats.
uh, threats to patients. So now try to answer this. You want to try it out yourself?
Yes, so I'll try it out. Nurse unit managers are direct to review their systems for the administration of oral anti-cancer drugs and the reporting of drug errors. Reporting of drug errors.
Okay, drug
So,
errors, right? So Nurse
Yes, sir.
unit managers are direct to review their systems on the admin on oral cancer and the reporting of drug errors. Right? Okay. It's
Mm.
just, but it's not saying that
Saying about the
they
yes,
go
sir.
unreported. Right?
Mm-hmm.
Okay. It's talking about drug errors in prescription, but it doesn't say that they
No,
are.
about the prescription.
It doesn't say that is the greatest threat, right?
Mm.
Okay. See, it's talking about reviewing the system, not saying it is there or not. It's talking about reviewing the system for
Yes.
for this purpose. Okay. Then next.
Serious concerns have been raised in a recent report drawing on a national survey of pharmacists.
Okay.
Okay. Please note the following paragraph quoted from the report. Incorrect doses of oral anti-cancer medicines can have fatal consequences. Over the previous 4 years, there were three deaths and 400 patient safety issues involving oral anti-cancer medicines. Half of the reports concerned the wrong dosage, frequency, quantity, or duration of oral anti-cancer treatment. Of further concern is that errors on the part of patients may be underreported.
Okay.
Underreported.
Underreported.
Go
Underreported. Right.
unreported.
Sorry.
Go unreported. Sir, unreported and underreported.
Is it the same?
Uh,
Think again. Think
no,
again.
sir. No, sir. No, no,
No,
no. It's
see,
not the same.
this is
Hmm.
this was the confusion that they're trying to create, right? Be careful of
Right.
these manipulations. Be Students, please be
Yes.
careful of such manipulations. There will always be
Yes.
such playing with the words to confuse you. Unreported means not reported at all. Underreported is not, it's partial reporting. Okay. Okay, continue.
Yes, it's partial reporting. In light of these reports, there is clearly a need for improved systems covering the management of patients receiving oral therapies.
So, in light of this report, there's a clearly a need to improve systems. Yeah, there is a need to improve systems covering the
Systems.
management of patients receiving oral therapies. Okay, so now
Mm.
here the options are there. I found a synonym. I found a very good synonym. It's giving me the answer already.
In light of the
Do you want to first strike out the wrong option, if it helps you?
so B, we can strike
Okay,
it off.
B, strike it out, right? Okay, what about this greatest threat? Is it mentioned anywhere about greatest threat? Greatest threat. Okay, I got the answer, but you try. Let me
Like
see your thought process. Which one?
incorrect doses of oral anti-cancer medicines can have fatal consequences.
Okay.
Uh,
Uh,
Over the previous 4 years, there were three reported wrong dosage frequency.
okay, incorrect doses and error
Yes,
in
sir.
prescription. Okay. Does it say this is the greatest threat? Is having fatal consequence the greatest threat?
Consequences.
Is it?
Yes, sir. It should be.
Okay. See.
I think so.
Okay. The report mentioned in the memo suggests that. Okay. Now compare this with this. Data about patient errors may be incomplete. Here, read this.
Yes, sir. Underreported or maybe incomplete. A. Yes, sir.
Yes,
A.
which is the answer? A, right?
A.
Why is
Yes,
it?
sir. because underreported is basically partially
Underreported is a
complete, so it's
synonym incomplete, right? Incomplete.
incomplete.
And also it is mentioned errors. Errors, yeah, here. Clear?
Hmm. Yes, sir.
Okay. Good.
Right.
Now let's go for the fourth one. Try it out. What point does the training manual make about anesthesia workstations? Yeah. So what point? So there's something which there's a training manual about anesthesia workstations. So what point does it make?
Okay.
Parts of the equipment have been shown to be vulnerable to failure. Okay, so parts of it have been shown vulnerable to failure. So
Um,
failure of parts
Vul-
or
Failure. Yes.
failure parts of the equipment failure. Can we say equipment failure?
Yes, sir. Equipment failure.
Yeah, equipment, like equipment failure, parts is almost the same, right? If the part is going to be failure,
Mm-hmm.
the equipment will also fail, right? Most probably.
Yes, sir.
There are several ways of ensuring that the ventilator is working effectively. So,
Ventilator
ventilator,
working effective.
yeah, effective ventilator, yeah,
Work.
effective ventilator, and first is failure of equipment, yeah, failure of equipment, effective ventilator. Okay, next, monitoring by health profession is a reliable way to maintain patient safety. So, monitoring by health professionals is a reliable way to maintain patient safety. Uh, patient safety. Let's keep it patient safety.
Patient safety. Yes, sir.
Yeah.
Hmm.
Monitoring is also there, but patient safety. Let's keep it the first
Monitor.
one. Okay. Now let's go for this. What does the training manual make? What point does it make about these workstations? Yeah. You can read it.
Anesthesia workstations. Studies on safety in anesthesia have documented that human vigilance alone is inadequate to ensure patient safety and have underscored the importance of monitoring devices.
Okay. But,
Uh,
alone is
these findings
alone
are
is inadequate,
reflected,
right? Alone is inadequate. So we're talking about monitoring, right?
right?
Studies have documented that human vigilance alone is inadequate.
Human vigilance alone is inadequate
So
to
monitoring,
ensure patient
it says
safety
here, it says monitoring by health professionals is
by
the
health
reliable way.
professionals.
Is it a contradiction?
No, it is contradicted that it is inadequate to ensure patient safety.
Yeah, it is
So yes, we can
inadequate, right?
strike it off.
So can you
We
strike
can
it out?
strike
Let's
it
strike
off.
it out. Okay, let's strike it out. Let's strike it out. C. Okay. So
Okay, sir.
because it says vigilance alone is inadequate. Here it says is a reliable way, because it's inadequate. It cannot be reliable. That is obvious. So we strike it out. C. Good news is now only we have two more, so it's
Two.
easier now.
Yes,
Okay,
sir.
let's go for the next one.
These findings are reflected in improved standards for equipment design, guidelines for patient monitoring, and reduced malpractice premiums for the use of capnography and pulse oximetry during anesthesia.
Okay, okay. These are
Several ways of ensuring that the ventilator is working.
sorry.
Sir, what is the B point, sir? Sir, you'll have to
There are
be able to
several
repeat
ways of
that.
ensuring that the ventilator is working effectively. There's one is several ways. So these financial, it's not talking about ways, is it? It's not about
No,
several.
sir, it is not. Yes, sir. Sir, I'll read the next line.
Okay,
Anesthesia workstations integrate ventilator technology with patient monitors and alarms to help prevent patient injury in the unlikely event of a ventilator failure.
okay. And SCA works to integrate. What do? They integrate ventilator
Mm.
technology with patient monitoring and alarms to
Yes, and alarms.
help prevent patient injury. Like, okay, But ventilator failure, where is the first option? Parts of equipment have been shown to be vulnerable to failure. Yeah, parts of the equipment have been shown to be vulnerable to failure. Let's match it and see if it is somewhere around the answer or not. Uh, in the unlikely event of a ventilator
Unlikely
failure,
event.
unlikely
See,
event, but it is not talking that, it is not saying that they have been
it is
shown to be
vulnerable.
vulnerable. So okay, see, this ventilator failure, this is a, they're just trying to confuse you. Yeah,
Yes,
here
sir.
see word failure, ventilator vulnerable, so don't get confused. Yeah, this is not the answer. Yeah, okay.
It's not the answer. Yes,
but
sir. We can
we, but
strike this
we
also.
but okay, fine, we can do that as well. Now let's go for the, but still we still need to know why is B the answer, right?
Yes, sir.
Read it.
Furthermore, since the reservoir nag is a part of the circuit during mechanical ventilation, the visible movement of the reservoir bag is confirmation that the ventilator is functioning. There are several ways of ensuring that the ventilator is working.
Yeah, got
Yes,
it.
sir.
Answer is B.
Yes,
Why it says
B.
furthermore, apart from that, since the reserve is a part of the circuit during the mechanical ventilation, the visible movement of the reservoir bag is confirmation that the ventilator is functioning, means working effectively, right?
Yes, sir.
Working effectively
Yes.
means
Mm-hmm.
ventilator is functioning, and
Functioning.
ensuring is a synonym of
Confirmation.
confirmation. All right, very well. So I guess this is, you're going to be quite confident with this now, right?
Yes, sir.
So that what I'm saying is, worst case scenario, get a 4. Most probably you might even get a 5 or even a 6. Okay, the more the merrier. But idea is that the concepts are clear now. Okay.
Yes.
Should we go for 2 more?
Yes, sir.
Okay. In cases of snake bite, the flying doctor should be aware of snake bite, right?
Mm-hmm.
Where to access specific antivenoms. So accessing antivenoms. Okay.
Venomous.
Second,
Yes, sir.
appropriate method for wound healing. So
Wound healing.
wound
Mm-hmm.
healing method. Third, patients most likely to suffer complications. Mm,
Suffer complications.
yeah, suffer complications. Yeah, or patient complications. Yeah. So here
Patient complications.
it's talk about being aware in cases of snake bite. The flying doctor should be
Mm-hmm.
aware of. So uh, accessing specific antivenoms. Yeah, specific antivenoms. So specific antivenoms. Second is wound healing,
Mm-hmm.
specific antivenoms, wound healing,
And
uh,
patient complication.
patient complication. Yeah, keep these three in your mind and let's read the
Yes,
text.
sir.
Okay, let's read it.
Memo to flying Memo to flying doctor staff, antivenoms for snake bite. Before starting treatment, do not wash the snake bite site. If possible, determine the type of snake by using snake venom detection kit to test the bite site swab or in systemic any envenoming the person's urine. If venom detection is not available or has proved negative, seek advice from a poison information center.
Okay, if possible, determine the type of snake by using a snake venom detection tech.
Right.
Available.
Sir, I need to read
Six.
the first point also,
You
where
wanna
it says
strike it out?
the- uh, sir, sir, I think B option I should strike it off.
B option, you wanna
Because sir, we
strike it out?
cannot wash. Yes, sir. So because
Yeah, because it's talking about the wound
you
cleaning,
cannot
right?
wash the snake bite site.
You cannot wash it, right?
Yes, sir.
Because it's here mentioned here right away. The first sentence says do not wash it, right?
Wash the snake bites.
Appropriate method of wound cleaning. So there is no. It doesn't say we cannot be washing it, right? Okay. So we remove
Yes,
that.
sir.
Now let's read the next one. But cleaning is not the same as washing, is it? Cleaning might be
So,
using this Dettol with what is it, betadine or something. So
betadine or
let's not
something.
strike it
Yes,
out,
sir.
right?
Okay, sir. Okay.
You know what I mean? See,
Yes, sir.
washing is not same as cleaning.
Hmm.
Can you clean without washing? Yes, you can, right? Using cotton and antibiotic, you can clean it, right?
Yes,
Can we do
sir.
that?
Yes, sir. We can.
That's why we do not be in a rush to strike out something. Just
Okay, sir.
wait, be patient and
Mm-hmm.
wait for the answer. Just because it's cleaning, and see, cleaning and washing is not the same. But in order to just strike out something, we cannot make that error, right? Leave it there.
Hmm.
Leave it there. We will see. Just leave it there for now. Okay. Now let's go for
Okay,
the
sir.
next one.
Testing blood for venom is not reliable. Assess the degree of envenoming. Not all confirmed snake bites will result in systemic envenoming. Risk varies with species of snakes.
Mm-hmm.
Sir, sir, the first part where to access specific antivenoms, it is written, no, sir, that if venom detection is not available or has proved negative, seek advice from a poison information center. No,
Seek
no, sir,
advice
so
from
nothing.
Poisonous Information Center, right? Where
Yes,
to
sir.
access this one? The A part.
A part, yes,
Ah,
sir.
if venom detection is not available or has proven negative, seek advice from so where to access information. You want to say that that is matching.
Yes, sir, it's matching.
Okay, let me read again. If it is if it is not available, yeah,
Hmm.
seek advice from a poison information center. But it does not mean that you can. It's not about accessing.
Specific antivenom.
No, yeah.
Access, yes,
See,
sir.
my dear,
Hmm.
seeking advice is not the same as accessing
Access,
anti-venom. See, accessing is physical,
antivenom.
right? You have to. It's a physical thing. You're accessing it. You're getting it. Advice is something else, right? Like I can just ask you over the, like, that's why be very careful. And these are
Okay.
the kind of answers which you'll get wrong. You know what I mean? These are the kind of questions I told you. Right out of six, these four went right. Here, this is where students get confused.
Hmm.
Don't just assume that it means the same thing. It does not mean the same thing, right?
Okay.
Cleaning and washing is not the same. In the same way, in the same way, accessing anti-venom is physical, like getting it, obtaining it, yeah.
Mm-hmm.
And advice is completely different. It is not the same. So do not be in a rush to strike that out as well, right? Don't
Okay,
strike
sir.
it out. Now let's go for the last part.
People with pre-existing renal, hepatic, cardiac, or respiratory impairment and those taking anticoagulant or antiplatelet drugs may have an increased risk of serious outcome from snake bite.
Okay, okay.
So the third one,
Which
the
one?
patients most likely to suffer complications.
Yes, yes, yes. People with pre-existing renal, hepatic, cardiac, respiratory, and those may have an increased risk. Most likely is a synonym
To
of
suffer,
increased
may
risk
have.
of serious outcome from snake bite. So there you go. We're gonna be clear. We're
Yes,
gonna
sir.
become closer to the answer, right? Let's
Yes, sir.
ensure that
True.
this is the answer.
Children are also especially at increased risk of severe and envenoming because of similar body mass and the likelihood of physical activity immediately after a bite.
There you go. This sentence established that this is definitely the answer, right? Because this is also a
Yes, sir.
specific group of people, right? So who are the most likely to suffer complications, right? These group of
Yes,
the
sir.
patients. So there you go. You see now in this, what were the errors that you were making? You were rushing to strike out something, right? But the answer was just
Yes, sir.
lying around the corner. The moment you finish,
Mm.
you started reading it, you got the answer, right? So lesson is, do not rush to strike out or eliminate the option. Yeah. And
Okay.
if even if you want to, if you have the urge to eliminate, even if you have the urge to eliminate it, make sure that you are 100% sure that the synonyms are the same, right? Washing, cleaning can confuse. Yeah, definitely it is. Of course, most likely people will get confused, and that is the trick of the exam, right? That's
Mm.
how they earn money. Okay, to simply put. And
Yes,
here,
sir.
accessing specific antivenoms, we have to understand accessing and seeking advice, way different. Okay, way different. There's no mention about any antivenom here, right? Clear? Is it done?
Yes, sir.
Let's go for the last
Yes,
one.
yes, sir.
You're doing pretty good. Only
Yes,
thing is that the third, this fifth one. But then see, this is how you will be sure of yourself, right? If you know what kind of errors can be there. Okay, now let's go for the sixth one. What was the purpose of the BM Tech forum? So, purpose of the forum, right? To propose a new way of carrying out cleaning audits. So, uh, new way, okay,
way.
new way cleaning audits, new way cleaning audits. Okay, new way of
Audits.
audits. I can say that also. New way
Yes, sir.
audits. Okay, next, to draw conclusions from the rest of the cleaning audit. So second is drawing conclusion. First is
Yes,
new way. Second is drawing conclusion, right?
yes, sir.
C, to encourage more people to undertake cleaning audits. So encourage more group
Encourage.
of people to take
Mm.
undertake cleaning audit. So third is encouraging to take audits, right? So a new way, inclusion, encouraging, right? So new way,
Encourage.
conclusion, encourage. Okay, now let's go for the paragraph. Read it, please.
Yes, sir. Sir, make it a little down, sir, because it's not complete.
It's fine now.
Yes, sir. Now it's complete. Yes, sir. 3 rounds of environmental cleaning audits were completed in 2013-2014. Key personnel in each facility was surveyed to assess the understanding of environmental cleaning from the perspective of the nurse unit manager, environmental service manager, and the director of clinical governance. Each
Okay,
facility
it is
received
not
a
helping.
report.
It is not helping us with the answer at all. Okay, so let's
Nothing.
read it further.
Each facility received a report about their environmental cleaning audit and lessons learned from the surveys. Data from the 15 units were also provided to each facility for comparison purposes.
Okay, did it help? Did it help anywhere?
No, sir.
No, right? Okay, so this is good news. If it did not help, means the answer is going to be here now.
Yes, sir. The knowledge and experiences from the audits were shared at the BM Tech TECT Forum in August 2014. The forum allowed environmental service managers, cleaners, nurses, and clinical governance to discuss the application of the standards and promote new and improved cleaning practice. The
New and improved
cleaning
cleaning practice,
practice,
right? New, so new way of. Okay, see, new
carrying out
way.
cleaning audits.
This is cleaning
Yes, sir.
audits, way of carrying out audits, and what is it talking about? New way of improved cleaning practice. So this is a.
Practice.
Let's strike it out. Can we
Yes, sir.
strike it out? Yeah.
Yes, sir.
So we strike it out. A. Okay. Read it further.
The second day of the forum focused on auditor training and technique with the view of enhancing internal environmental cleaning auditing by the participating groups.
Okay. Now, out of these two, So after training and technique, view of
Enhancing.
enhancing, view of enhancing environmental cleaning audits, enhancing. You want to go for the answer straight away? You want to strike out something? Okay, draw a conclusion from the result, right? Result. Well, let's see where the result is.
Sir, I think so C should be the answer.
Okay, very good. And why is that?
So because so in the last line,
Okay, okay.
yes,
Encourage more groups to undertake cleaning audits, right? It says,
sir. Cleaning
uh,
order by participating groups.
okay, second day of the forum auditor training and technique with the view of enhancing internal environment or cleaning auditing. Okay, by the participant. This is talking about enhancing what? Enhancing the internal environment cleaning audit. Okay, encourage more groups to undertake the cleaning audits. Is it the same? Enhancing internal environment. Yeah,
Mm-hmm.
undertaking cleaning audits. Think about it. Think about it for a few seconds. Compare this. Undertaking cleaning audits, enhancing internal environmental cleaning auditing.
No, sir.
No, right? No,
No.
this is undertaking cleaning audits. Like more people, okay, you guys should also take cleaning audit. You should also take. Please take. This is encouraging groups, right? This is
Yes, sir.
enhancing the internal environment,
By
right?
participating.
Yeah,
Yes, sir.
it's not the same. So we strike it out.
Oh, yes,
Strike it
sir.
out. What we have, the answer is B. Okay, B. Now let's say let's say why is it draw conclusion. Okay, so each facility received a report about their cleaning audits and lessons learned from the survey. Lessons learned. Draw conclusion. Right? Data from the units was also provided for comparison purposes. Right? So you see, everything is leading to this. Right? These are the results. Correct? Report about their environment, lessons learned, right, and comparison, and then knowledge and experience from the audits were shared. So what was drawn? Draw conclusion. Conclusion, is it knowledge and experience? Is it related to this? Is it?
Yes, sir.
So therefore the answer is B.
Okay, sir. Yes, sir.
All right, so I hope this explanation was pretty crystal clear for you. You got it. Most of the
Yes.
answers, you see, the first four were okay for you. It was pretty simple. You could do it. Last two got a little bit confusing. That's why I'm saying that be a little bit more careful about the synonyms. Do not rush. Do not rush to strike out or eliminate the wrong option, and also do
Mm-hmm.
not try to basically just read it in more detail. If like in the last one, what happened is that when you think that, okay, like underreported or unreported, this is how the manipulation happens in these exams. Yeah, so that's about it.
Okay, sir.
Any other questions or anything for me?
No, sir.
Okay, thank you very much,
Sir,
students,
I'll
and
practice,
I
sir.
hope this class really helped you. So continue practicing. Best of luck.